lying. You can take your hand and support her head. So you would come up under, actually, right through there. Good. Perfect. Hi, little one. Now with your bottle, you're going to hold it like that. You're going to rub her lips and say, hey, can you latch for me?
Fine.
So you want to ask permission, and we want to see some of those hunger cues. And then you want that bottle all the way in her mouth. There you go. Now if she go chug-a-lugging too fast, all you do is you drop the bottle so that it slows the flow. Okay? So you can bring the bottle up and down and up and down so that she doesn't chug too fast. There you go. Now the nice thing, if you want to elevate her, right now she's in a breastfeeding position, right? She's horizontal as if she were at the breast. You could also just raise your legs up. Aww. And now she's a little more elevated, or you can put your legs down and she's a little more reclined. So you can kind of play around with that. And that mimics mom, whether she's in sitting upright or semi-reclined. Okay. Now what I like is her lips are nice and flanged. Her upper lips flanged. You want her as wide on this bottle as you can latch her, as if she's at the breast. We want to teach her good bottle behaviors. We want the bottle to mimic the breast and not the other way around.
So we've been pulling it back and like making it a little more shallow, thinking that we were like giving her too much. So that's really good feedback.
So if you're giving her too much too fast, you drop the bottle to slow the flow.
Yeah.
But you want to keep the nipple in her mouth as deep as possible because you want that nice wide latch on the bottle. Now, if she starts moving, she's telling you, I'm uncomfortable with something. So you can always pull the bottle out, slow it down. You could burp. Yeah, see, she got a little bit too fast. So babies are really good at communicating all the time. We just have to figure out what they're communicating. So if the head is moving, it's telling you, I'm trying to latch, I just can't feel it. And if the body's moving, she's telling you, whoa, something's, either my body's uncomfortable or I feel a bubble or something else is going on.
Okay, that's really good info.
Okay.
So let's try this again. Hey, sweetheart.
Yep, so you're going to rub her lips and have her latch to it. Good. You see that nice wide mouth? She's like...
So you're looking for the same response as when she approaches the nipple.
The breast, yep. Because we can force this bottle nipple into her mouth, but we can't force the breast in her mouth. So we want her to learn how to latch to the bottle as if she's latching to the breast.
That makes complete sense.
Now you have her just a little bit rolled back. Yep, there you go. Have her a little more on her side. Now note her hands. If her hands were to come up and hold the bottle, I'd be fine with that too. But she's in this nice relaxed position. Her head's just a little bit extended. Ear, shoulder, and hip are in a straight line. She's coming straight to that nipple just as if she's at the breast. So that's good bottle behavior.
Great.
And now do you see that? Do you hear the swallows? So she's going suck, 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 swallow, suck, suck, swallow. Those are the same patterns we want to hear at the breast. There you go. If you hear clicking, she's breaking the latch. She's breaking the seal on that. So push the nipple in a little bit further to help with that. There you go. Yep. Now, do you see how her body position changed? You did a really good job reading her cues. So she got fussy down here. So you pulled back on the bottle, you repositioned, you readjusted. Now look at how nice and quiet her body is. She's very relaxed. She's ready to feed.
Didn't even know I did it.
We walked you through it. And what I like about this position is her whole body is supported. And how do you feel? Do you feel pretty comfortable?
Completely.
Yeah.
I'm about as relaxed as I can be.
And that's good feeding. You can hear her really taking her time. You don't want her to go chug, chug, chug. We don't want to beer bong the baby.
Yeah.
Because then she learns that I get to beer bong the breast, which doesn't happen like that. So we want her doing this. She's doing really good job self-pacing. She's doing some sucking and swallowing. She's taking some breaks. She's doing some sucking and swallowing, taking some breaks, just as if she were at the breast. Now, what I always recommend is put a little more in the bottle than you want her to take, because when you get to the end, your impulse is going to be to try to shake it in her mouth and tip it to try to tip that bottle back. And
that's not natural.
Yeah, it's not natural. So having a little extra in the bottle will give you that cushion to stop without feeling like you have to shake the bottle.
Right.
See, I know, right? She agrees with me. Yeah. And that's perfect. I like how you intuitively took your hand and gave her just a little extra support. That's perfect. Nice break.
This is way easier to have her in line with your legs. We tried to do this, but in line with the body, and it's not
It's a
ergonomic for
little
the
more
wrist and the
awkward.
bottle. So you have like a
Yeah.
really good view and more adjustments in this position.
Well, and the nice thing I like about this is you can see if her color changes. You can see if she becomes fussy.
Yeah.
And look at that nice alignment, right? When we feed upright, the older baby, how we like normally see
Yeah.
babies feeding, they can tend to be a little bit more in a horseshoe shape
Yep.
or a little more hunched. But when you have them on her lap, you can really see she's at the exact same position at the breast, ear, shoulder,
Yep.
and hip in that nice straight line. Her head's just slightly extended. Her nose is up off the bottle nipple, but that nipple's still nice and deep in her mouth. She has a nice deep latch.
I can see her bottom lip.
Yeah.
Yep, you can see the bottom and the top lips flanged out
So
nicely.
no, I've been holding the ball like I've been holding the ball wrong. They should be like closer. Like they're hurt.
But when you know better, you do better. So
Yeah.
you didn't know. It was your
Yeah.
first rodeo. So now that we have a new skill, now you can do it next time.
First rodeo, never rode a horse.
And you want to think of it, it takes about 20 minutes for the stomach to tell the brain that it's full. So I'm okay having a nice low volume for a small amount of milk. When you have a newborn, they want to take 1-2 ounces, right? But it's still going to take their tummy 15-20 minutes to register that it's full. So I'm fine with her going nice and slow, taking in that volume, because then we're teaching her when your tummy's full, your brain's going to help you tell that it's full.
And to follow her cue when she wants
And
to
follow
stop
her
rather
cues.
than thinking you need to finish the bottle and be
Exactly.
fixated on the volume.
Exactly. So you may notice that she unlatches herself and pulls back. You may notice her body start to get a little fussy. You know, there's a couple different ways that babies will tell you that you're done. See how she, yep, there you go.
And so then
So
just
she's
be okay
done.
with it rather than thinking, oh.
Like don't try to reinsert at this
Right.
point.
And there's the spit up. So she's like, yep, I'm full.
Okay.
There you go.
Time to
Right
bite
on
you.
time. You're such a good model.
Time to